Good day, everyone. We are Group 4 from DDM5 E1. Today, we are going to share our oral presentation pertaining flattening the curve, the Philippines and COVID, a Google Trends analysis. The emergence of COVID-19 significantly reshaped the course of human history, creating a ripple effect that altered various aspects of life around the globe. The virus emerged in late 2019, first identified in Wuhan, China, and quickly escalated into a global pandemic. It caused respiratory illnesses that varied in severity, from mild symptoms to life-threatening conditions. COVID-19 left no corner of the world untouched. The Philippines, a nation with a population exceeding 113 million, was one of the many countries impacted by the pandemic. In January 2020, the Philippines reported its first confirmed case, a harbinger of the challenges that lay ahead. The quick spread of the virus placed immense pressure on the country's healthcare system, which was already dealing with various pre-existing challenges. Hospitals become overcrowded, healthcare workers face unprecedented level of stress, and the national health infrastructure was tested like never before. As the virus continued to spread, the government implemented various measures aimed at curbing its transmission. This included lockdowns, travel bans, and social distancing protocols that changed the way people lived, interacted, and worked. Communities faced various challenges, including disrupted economic activities, unemployment, and growing mental health concerns. Business, large and small alike, struggled to adapt to the new normal, leading to a significant downturn in the economy. The societal interest in the COVID-19 provides valuable insights into not only the medical aspects of the pandemic but also the underlying anxieties and concern that gripped the population. People sought information on the virus, its transmission, vaccination progress, and safety measure more than ever before. Understanding this concern is crucial as they reflect a collective state of anxiety, hope, and the quest for safety amidst uncertainty. Recognizing the importance of tracking public interest, this study aims to utilize Google Trends to explore search patterns related to COVID-19 within the Philippines. By analyzing these search trends over time, we hope to shed light on the public evolving concerns and responses during various phases of the pandemic. For instance, we may observe spikes in searches related to symptoms and testing during peak outbreak periods, indicating heightened concern over illness. On the other hand, searches related to vaccine and safety guidelines may show a shift in public focus toward preventive measures and recovery. In analyzing these trends, we can offer a more profound understanding of how the populace responded to the evolving landscape of COVID-19, influencing both public policy and community actions in the fight against the virus. Through this study, we hope to inform health authorities and policymakers about public sentiment and knowledge gaps in order to formulate more effective communication strategies in future health crises. Understanding and addressing the population's concern is paramount, not only for managing the ongoing pandemic but also for preparing for potential future health challenges. By harnessing technological tools such as Google Trends, we can derive insight that help us navigate through these unprecedented times with the understanding and foresight needed for resilience and recovery. In doing so, we move a step closer to understanding the collective human experience in the face of a global crisis.
So, for the methods, this study employs a descriptive approach by summarizing, demonstrating, and describing the dataset. Through this, we can extrapolate an analysis of the search patterns for COVID in the Philippines over a 5-year period. The chosen time period was between the years 2019 to 2024. Google Trends was chosen as the primary tool for the purpose of data collection. It allows us to track the relative search volume for COVID within the selected time frame. This metric reflects fluctuations in search volume for the term as compared to the overall search volume on Google's search engine at any given time. By analyzing these fluctuations, we can identify trends and patterns which represent the public's variations in interest and concern on the COVID 19 phenomenon. Interpretation of these trends will be based on significant fluctuations in the search volume and compared to the timing of major events in relation to the pandemic in the Philippines. This will allow us to draw connections between real world events and the public's online information seeking behavior.
As to the results and discussion portion of our presentation, we have formulated a line graph showcasing the fluctuations in search interest over time for COVID searches in the Philippines from the years 2019 to 2024. Based on Figure 1, there were no search queries for COVID in the Philippines around March 17, 2019 at a value of 0%. Search interest for COVID had only begun to rise during the month of February of 2020 by a value of 1 to 3%. Eventually, search interest erupted in an immense spike during the month of March 2020, reaching its highest peak of 100% across the selected time frame. However, search interest underwent a steep decline entering April 2020. Fluctuations in interest were observed until it reached its lowest peak for year 2020 from December 20 to 26. From January to November 2021, search interest remained around the range 18 to 37% until it reached its lowest point of 9% for December 19 to December 25. Immediately after this point, interest surged to a peak of 42% in January 2022, the highest observed since the first massive spike during March 2020. From here, interest swiftly dwindled until only 1% of the search interest remained until the current day of the study, March 2024. On to the next figure, we observe interest by subregion of COVID searches in the Philippines from the year 2019 to 2024. Based on this figure, the top five subregions by volume of COVID searches were Metro Manila, Mimaropa, Cagayan Valley, Calabarzon, and Ilocos region. The Metro Manila subregion ranked first according to the volume of searches. A value of 100 indicated its intense popularity in this region. The Mimaropa subregion came second at an 88% popularity value for COVID first searches. Cagayan Valley ranked third at an 87% popularity value, and Calabarzon subregion ranked fourth with 85%. At fifth place, we have Ilocos region, which had a value of 83% popularity for COVID searches by volume. Let's proceed to the discussion section. The data analysis revealed distinct patterns in search volume over time and across subregions that much is true. The peak search volume during the month of March 2020 coincided with the declaration of COVID-19 as a global pandemic by the World Health Organization. The subsequent decline in search volume suggests a decrease in interest after the initial public anxiety. Further decline from a new renewed interest in January 2022 reflects a potential desensitization or information fatigue of the public as the pandemic progressed. Fluctuations in search interest could be attributed to the following factors: emergence of new COVID variants, changes in government protocols, adjustments such as adjustments in alert level system, implementation of curfew hours, increased COVID-19 testing availability, introduction of testing requirements, implementation of travel restrictions or regulations, updates on vaccination such as booster shot programs, local outbreaks, media coverage, as well as internet access. These are all things that influence the volume of search queries for COVID.
Now let us move on to the conclusion. This study examined COVID 19 search trends in the Philippines from 2019 to 2024 using Google Trends data. The analysis revealed distinct patterns in search volume over time. A significant surge coincided with the global pandemic declaration in March 2020, followed by a decline as the public became more familiar with the virus. Notably, search volume peaked again in January 2022, potentially due to the emergence of new variants or changes in government protocols. The study also revealed disparities in search volume across sub-regions, with Metro Manila exhibiting the highest interest. This variation suggests a potential influence of population density, internet access, and regional media coverage on information seeking behavior. While Google Trends offer valuable insights, limitation also exist. Search volume does not necessarily translate to accurate knowledge acquisition, and beyond that, user intent cannot be ascertained. So, to gain a more comprehensive understanding of public knowledge, concerns, and information needs regarding COVID 19, future research could incorporate additional methods such as on the ground service, social media analysis, or a deeper exploration of specific search queries. Such an approach would provide richer insights into how people respond to health crises. Lastly, this study hopes to contribute to understanding the dynamics of information seeking behavior during a public health crisis such as a pandemic. Analyzing search trends alongside public health events can help formulate new strategies for communication and dissemination of information to better address emerging concerns, particularly and especially in areas with limited internet access.